Welcome back. This is Dr. Cash at Dr. Cash Medical and Life. Today we'll be discussing about a topic on a medication in the class of GLP-1 Agonist. And namely, the brand name for this class of medication is Mounjaro or also Wegovy. Now, traditionally, this class of medication has been developed over a decade ago for the treatment of diabetes. But recently, you may have heard on the news that a lot of people have been using this class of medication to help with the treatment of obesity, as obesity has become much more common in our society. And so, with any medications that you get the benefits from, you can potentially get the side effects or the risk involved. Now, this class of medication has the common side effects that a lot of other medications also have, including nausea, vomiting, abdominal cramping, a lot of gas production, rash or hypersensitivity, or even pancreatitis, okay? And so it's not quite unique, but what is unique in the situation, or you may have a question about this class of medication, is does this class of medication cause pancreatic cancer? Okay. And if you're taking this medication, whether it be Mounjaro or Wegovy, for obesity, is it worth it? Is it worth risking your life to lose some weight at the cost of possible developing pancreatic cancer? And so it's a very valid question, because it has been raised many times over the course of the last decades or so that this class of medication has been in use. Now, just to give a little background or a little story, about 4 weeks ago, I was taking care of a patient who 63 years old. We just named her Mrs. Thompson for her protection. But 63 years old, morbidly obese, and she has been struggling with weight all her life. And finally, 8 months ago, she decided that she wanted to go ahead and lose the weight once for all. So she talked to her doctor, and they started her on Mounjaro. Started and have some of the common side effects, nausea, vomiting, and then she started to lose weight. And then 2 months, 3 months, 4 months into it, she continues to lose weight. She lost about 40 pounds. And her pain, which she attributed to as a side effects, became more and more pronounced and progressive, and to the point where she just can't eat anything. And she's been continuing to lose weight until she started noticing that her eyes are actually turning yellow, and her skin, her face, her husband told her that she was turning yellow. So she decided to come to the emergency room and run a whole bunch of lab tests. She had abnormal liver tests, pancreatic test was abnormal, a CT scan was done, and she had a large mass in her pancreas. Okay. And so when I took over her care, one of the first things that she asked me is, "Hey doc, did my taking of this particular medicine has anything to do with this huge mass that I have right now?" And so the question that she has is pretty valid. And we know that these medication works at the level of the pancreas, with those receptors in the bowel and the pancreas. And when you do that, potentially, is the potential for pancreatic cancer there? Yes, I think so. Now, has it been shown that these class of medication has been linked or caused pancreatic cancer? We'll see. Okay. So as I mentioned earlier, the common side effects, nausea, vomiting, even diarrhea, gas, bloating, abdominal cramping, pain, those are common. Those are reversible. Once you stop, those things goes away and you're okay. But when it comes to cancer, it's a situation of life and death. Now, are you willing to trade losing 10, 20, 30 pounds or 40 pounds over potentially dying? So that is the question. So in addition to the more common side effects that this class of medication have, the FDA actually required that this class of medication, the manufacturer needs to put a black box warning on this class of medication. If you read the black box warning in Mounjaro or in Wegovy, you will know that they will label it black box warning, and it will say if a patient has any history of medullary thyroid cancer or thyroid C-cell carcinoma or multiple endocrine neoplasia type 2, then the patient should not take this class of medication, because studies in rats have shown that for the rats that has had these type of changes in their system, will definitely increase the chance of developing cancer of these type in a dose-dependent and also a time-dependent fashion, meaning the longer that you stay on it or the more dose that you have, the higher chance you will have in developing these type of cancer. So black box warning, FDA requirement. Okay. Now there is the question then finally, and probably the most serious one is, does this class of medication cause pancreatic cancer? Now, since the inception or the development of these medication, that question has always been there. And there have been many studies looking over hundreds of thousands of patients over the last decades or so. And I have read through a whole bunch of them. And the consensus, at least for now, is that there is not a direct link or indirect link that this class of medication, the GLP-1, such as Mounjaro or Wegovy, link directly to pancreatic cancer. So definitely that is good news for people who are on it, particularly for weight loss. Now, there's currently a study in Europe that are looking over 600,000 people. It's going to take a couple of more years. By the end of 2024, they will do a big old analysis and will look particularly to answer the question of this class of medication and also the potential causation of pancreatic cancer. So in the 2-year terms, we will have more information on this. But as of now, the GLP-1 agonists, such as Mounjaro or Wegovy, have no direct causation for pancreatic cancer. Okay? And so I hope you find this information useful, helpful. If you have any question, concern, or if you heard something else different that you would like to share, please comment down below. As well as I will go ahead and list the articles that I have referenced, that I have read through under the descriptions. And if you have interest in reading them, many pages with a lot of calculations and jargons and such. But if you're interested in reading them, feel free to do so. So finally, if you find this information to be helpful, to be useful, please subscribe to my channel, and I hope to see you next time. Have a good one. Bye.